Hello, my name's Kim. I'm one of the cardiac rehabilitation sisters here at BHRUT, and we've put together some educational talks for you, and we'll be presenting the pharmacy talk with one of our pharmacist technicians.
Right. Hello everyone, my name is Indy. I'm one of the pharmacists working at BHRUT, and today's presentation is just to go through some of the medicines for the heart. Okay, so the aims of the session today is to understand how your medicines work, what the main side effects are of these medicines. We'll go through the different types of medicines that you have that you'll be taking after a heart attack, and we'll go through some of the side effects, the pros and cons, and the best way to deal with these medicines, and some of the resources that you can use if you've got any more questions to go through. Okay, so there are different types of medicines and they help to treat different risk factors. And when I discuss risk factors, I mean things like high blood pressure or high cholesterol. And you'll be on certain drugs to help to combat these sort of risk factors, and these help prevent having another heart attack from happening. We'll also go through the drugs that help reduce the workload on the heart, and there'll be some medicines that help improve the pumping power of the heart too. So if you've been told by your doctors that actually, you've had some damage done to the heart muscle, there are certain medications that can help improve the pumping power of the heart, and we'll go through those types of medicines as well. Different drugs work in different ways, so you might go from being on no medicines at all to suddenly being on 5 or 6, which can be quite daunting. And we'll go through each of these, and the reason that you're on such a high number of medicines is because actually they all work in a slightly different way, and that helps to provide the best outcome. Being on different medicines provides the best therapeutic benefit as well, so we'll go through all of that in the presentation today. Okay, so I'll start off by going through some of the side effects. There's two types of side effects. One type is what the drug does to your body. For example, if you're on a medicine that helps lower your blood pressure, what can happen with taking those type of medicines is you can feel quite dizzy or quite faint, and again that subsides with time. If you're noticing any type of side effects like this, it's important to let someone know, whether it be your community pharmacist or your GP, or even the cardiac rehabilitation team. If you give them a call and let them know about that, they can always help to discuss possible alternatives or ways around that. The other type of side effect is actually not due to the action of the drug, and that's if you come up in a rash, or if there's any shortness of breath or any swelling or anything like that, in which case, the drug needs to be stopped immediately, and you need to tell someone about that, because then you'll definitely need to go on some sort of alternative. Many side effects subside with time. So you have to give the drugs a chance to work, and your body to find that balance so that it's used to the drug working. In some patients this might take a week or two. In other people it might take a little bit longer. So there is an element of just trying to persevere through that initial maybe first couple of weeks while you're on this medicine. Let your body get used to it, and then if you're still having problems after that, come and speak to one of us, whether it's the pharmacist or your GP around that. Okay, so the different types of medicines for the heart that prevent another heart attack from happening. There's beta blockers, what we call our antiplatelet drugs, statins, which help lower cholesterol, and something called ACE inhibitors, which help with blood pressure. And I'll be going through each one of these now. So let's start. We'll start with the antiplatelet drugs. Okay, so antiplatelet drugs, they make the blood less sticky, that's their job, and they prevent clots from forming. Okay, the main antiplatelet drug that I want to go through is aspirin. Most of you will probably be on aspirin, a small white tablet, 75 milligrams once a day. A lot of you will probably be on the dispersible tablet. That's not to say you have to disperse it in water. I can't imagine, it probably doesn't taste too good. You can have it with a full glass. There's no need to disperse it at all if you don't need to. Okay. The other type of antiplatelet drug is either clopidogrel or ticagrelor or prasugrel, and they work alongside the aspirin to make the blood less sticky. Now, if you're on clopidogrel or ticagrelor or prasugrel, you will be told how long to take that for, and this varies. Generally it's 1 year, but it can be less time than that. So just make sure when you get discharged from hospital you understand the length of time that you should be on this medicine, and that it's reviewed by the GP at that point as well. Now the main side effect with these medicines is obviously because they're making your blood less sticky, you're more prone to bleeding and bruising easier as well. So you just need to be cautious of that. heavy contact sport is going to be worse off if you're playing any sort of heavy contact sport. If you cut yourself or you're shaving, you might notice you bleed a little bit longer. Again, that's side effects we expect with this medicine. If you're coming out in a lot of unexpected bruises and it's happened after taking these tablets, then again, let someone know about that. It might be an indication that the tablet's working too well when we might need to review it. Both of these tablets, the aspirin or its sister drug, should be taken with or after food. And the reason for that is it helps to protect the lining of the stomach, because the other side effect you can get with these type of tablets is stomach irritation, okay? So it's always good to take it on a full stomach. Now, one of the drugs that you may be prescribed is a drug called lansoprazole. That's got nothing to do with the heart. That's just there to protect the stomach against these two antiplatelet drugs. So again, that will be maybe 15 or 30 milligrams that you're taking once a day, and that's just to protect the stomach, so nothing to do with the heart. Again, that should be taken half an hour before food, but your antiplatelet drug should be taken with or after food. Now, what I would say about the antiplatelet drugs is you need to be careful of taking other medicines, especially ones over the counter. So things like ibuprofen or Nurofen, or what we call the non-steroidal anti-inflammatory drugs, these can increase the risk of bleeding when you're taking these antiplatelet drugs. So it's very important that, you know, if you're using anything for pain, paracetamol is good to use. Even colchicine, which has a bit of codeine, that's absolutely fine to use as well. There's no issues with that. But please try and avoid your non-steroidal anti-inflammatory drugs. If you're not sure, if you're buying it over the counter, speak to the pharmacist. They're all aware of these interactions. They can guide you to the best option. Okay, so the beta blockers. These are normally drugs that end in lol. So things like bisoprolol, atenolol, metoprolol, carvedilol. And how they work is they reduce the heart rate and help to slow down the heart, make sure it's not overworking. They protect the heart after a heart attack, and they reduce blood pressure as well. So they do quite a few things, and they're really, really good, and we've been using them for many, many years. They also prevent any angina attacks. So if you're someone that suffered with angina in the past, this helps to resolve the angina as well. Now, the main side effects with these beta blockers is fatigue and tiredness. Because we're slowing your heart rate down, you will feel a bit more tired than normal as well. And you know, us being human, no one wants to take medicine. So, you know, the first thing we'll do if we're feeling tired and fatigued is blame the medicine, stop the tablets, and think, actually, I feel a lot better if I'm not taking it. The thing with beta blockers is you have to kind of persist with it for the first few weeks. Let your body get used to the tablet, and then you'll start seeing the benefits of it. Again, the beta blockers should be used long term, and it's very, very important that you don't stop them abruptly without telling anyone. The reason for that is because actually what can happen is your body is used to now a lower heart rate. When you remove the drugs from the system, your heart rate shoots up, and that can be quite dangerous for the heart. So you must always let someone know if you actually think these tablets don't agree with me. Speak to your GP, and then they can try and wean the tablets off or use an alternative. But it's very important that you just don't stop abruptly yourself, especially if you've been taking them for a while, because your body does get used to them. The other thing you'll get potentially alongside any sort of tiredness or fatigue is cold extremities. So you might notice that your tip of your nose is quite cold, or your fingers or your toes, and usually they're not. That's because the blood's not getting to the peripherals as quick as it normally does. And again, your body needs some time to just adjust to that. Whether it be a week or a month, it just needs a bit of time to adjust. Okay, let's move on to the next drug. So the next drug is the ACE inhibitors, and they work alongside the beta blockers. And they normally end in pril. So we're talking about medicines like ramipril or lisinopril, enalapril, or perindopril. Anything that ends in a pril is an ACE inhibitor. And again, how it works, it helps to reduce the blood pressure, and it's really, really good at doing that, one of our best that we have. It also protects the heart after a heart attack and improves the pumping power. So how I said earlier, if you've had any heart muscle damage done, this helps to improve that pumping power of the heart. And again, it only works if you're taking it for a long time. So it won't start showing those benefits if you take it for 1 month or 2 weeks or a week. You need to take it long term, and that's how it shows that benefit. Now, it's normally a once a day drug, but the main side effects of this drug is you can feel quite dizzy, because it's dropping your blood pressure. So if you're someone that's actually started taking an ACE inhibitor and you notice actually I'm feeling a little bit dizzy, then maybe take it at night when you're in bed and you won't feel the side effects as much. And that's the same thing with the beta blockers as well. Maybe try taking it at night if that's the case. People have sometimes noticed they can get some taste disturbances with the tablets as well, but again, that does improve with time. One of the side effects that we do have alternatives for is a dry cough. Now, if you're someone that's taken an ACE inhibitor and then you develop a dry cough, there are alternatives to the ACE inhibitors that we can use that don't give you the dry cough. So if you're someone that suffered that and maybe you haven't had a cold or anything else going on, you think actually it's this tablet, please come and speak to your pharmacist, your GP, come and speak to the guys at the cardiac rehab team as well, and they can look at maybe discussing that with one of the doctors here. I'll move on to the ACE inhibitors now. So these are called your ARBs, and this is the alternative that we use if you're developing that sort of dry cough with the ACE inhibitors. So these are drugs that end in artan, things like losartan, valsartan, candesartan, irbesartan. Anything that ends in an artan is what we call an ARB, and this would replace the ACE inhibitor. So if you're not getting on with the ACE inhibitors, we can use these ARBs, okay? Works very similar to an ACE inhibitor, does the same sort of thing. The reason we don't use this as our first line is because actually all the clinical trials and things were done with the ACE inhibitors first, which is why we like to use the ACE inhibitors. The main side effect, again, is dizziness because it is dropping your blood pressure, but otherwise it's very similar to the sister drug. So we move on to statins, the cholesterol lowering drug. Now, people always ask me and say to me, why am I on a statin? My cholesterol is absolutely fine. I've had a heart attack, but I used to run before that, and my cholesterol is, in a good range. I've been told by my GP that my cholesterol is really good, and then they give me this whopping big tablet. It's hard to swallow. I don't know why. Well, yes, it does drop your cholesterol, and it's really good at doing that. In fact, if you take it for a month, you should see a 40% drop in your cholesterol levels, which is quite big. The other reason is also reduces the swelling, or what we call the inflammation around the heart after a heart attack. So if someone fit and healthy, like myself for example, was to have a heart attack, even I would go on a high intensity statin, we call it. And this would be long term because it helps reduce that swelling around the heart, okay? And it only works if you take it long term. So our statins, we have atorvastatin, and generally we go with atorvastatin 80 milligrams, which is the highest dose, but we can also use atorvastatin 40. There are other statins that we use, things like simvastatin or rosuvastatin, pravastatin or fluvastatin, but generally we like to use atorvastatin because that's where all the evidence base is. The effects are seen within 3 to 6 months, but again you'll see that 40% drop in the first month. And that's how we know you're taking it when we do your blood tests as well. In terms of side effects, you just have to watch out for muscle pain really. That's one of the big things. Sometimes people feel like there's things maybe crawling or they're getting cramping in the legs. If that's the case, it's very, very important that you come and speak to someone, and maybe we can change it to a different statin, or patients have found actually halving the dose of the statin that they're on has really, really helped. So it's important that you let someone know about that. A statin is better than no statin, we say. So there are alternatives to the atorvastatin if you're not getting on with it. It can interact with other medicines as well. So what you might notice is if you're on some antibiotics for 5 or 7 days, you might be asked to stop taking the atorvastatin. But once the antibiotics or interacting drug has stopped, then you can restart it after that. Okay, nitrates. So this again is not for helping prevent another heart attack, but it's just there for symptom control. So your GTN spray, hopefully everyone was discharged from the hospital with a GTN spray, little red bottle with a white top. Hopefully everyone knows how to use it, but if you don't, I'll quickly go through it now. It's always one spray underneath the tongue. Some people have used it on their teeth and it doesn't work, or they spray 3 or 4 times underneath the tongue and it works too quickly. So it's just one spray underneath the tongue. If you're getting that angina or that sort of chest pain, you wait a minute. If it's not working, then spray again underneath the tongue. Use it 3 times. If after the 3rd time you're not seeing any benefit, then it's time to call for help, 999. Make sure that you're seen by someone very quickly. What I would say about the GTN, it does drop your blood pressure very, very quickly, and because it's trying to open up the vessels of the heart. So maybe take a seat before you take it, because if you're spraying it a couple of times into the mouth and you notice your blood pressure drops, we don't want you to collapse. So make sure you have a seat before you take it. The other thing I would say about your GTN is make sure you check the expiry date on the bottom. You don't want to be in the boat where actually, you haven't used it for a year or so. Then you start getting those chest pains and you feel, actually, I need to get my GTN spray, but it's expired by a month. Should I take it? Should I not take it? You don't want to be in that boat. So make sure you're just checking the expiry of that as well. We do have longer nitrates, what we call isosorbide mononitrate, which is used once or twice a day, and that provides relief throughout the day. So if you're someone that suffers from angina pains quite a lot of the time, then you might be on something like that as well. In terms of main side effects, well, you can sometimes get quite dizzy, it can cause headaches, and again, you can get quite flushed as well the first time you use it, but your body does get used to it after a while. So hopefully you've all got your GTN sprays. If you haven't got a GTN spray and you're someone that suffers from angina, please raise that with your GP and they can sort that out hopefully for you. Okay, some other sort of drugs as well. So we have what we call anticoagulants. Now, this is not prescribed for everyone that's had a heart attack, but if you're someone that suffers from things like atrial fibrillation, you may be on a drug called warfarin, or what we have now is a newer agents called rivaroxaban, edoxaban, dabigatran, apixaban, and again these are blood thinning agents similar to the aspirin and clopidogrel. And if you're on these tablets, this is something to be aware of, that actually it does increase your risk of bleed. You just need to be a bit more careful when you're using these drugs. So other type of medications, if you've been told actually you've had quite a lot of damage done to the heart muscle, you may be prescribed something called spironolactone or eplerenone, and these work alongside the ACE inhibitors to improve the pumping power of the heart. Again, they do drop your blood pressure, so you can sometimes feel a bit dizzy with these to begin with, but your body does get used to them with time. And not everyone's prescribed this. It really depends on the amount of damage that was done to the heart muscle. We do have other blood pressure tablets as well called amlodipine. If you're on a tablet called amlodipine, I guess the main side effect that you need to be aware of is it can cause ankle swelling. So if you're someone that's actually on an amlodipine tablet and you notice, I wasn't suffering from ankle swelling before, but it's kind of happening now, then make sure you speak to your GP so we can look at an alternative for that. And then the last sort of drugs I want to speak about again are ones to help with symptom control of angina. So we have tablets like nicorandil or ranolazine, and then these work with your nitrates to help open up the vessels of the heart and make sure you're not getting those angina pains. But again, those tablets won't be prescribed for everyone, just those that suffer with that angina. Okay. So just some general information really about your medicines. Always keep them at the right room temperature, keep them out of the reach of children, and renew your prescriptions on time. So pharmacies are not always open all the time. Bank holidays and things, sometimes they're closed. If you're going on holiday, make sure you have enough of your medicines beforehand, before you go. Make sure you get a prescription into your GP in good time. And actually what I would say, there was a lot of information in today's session, but if you have any questions or you feel, actually there's other tablets that I'm on and I'm not too sure about, I've been discharged from the hospital recently and I've been given 6 or 7 tablets and it's just too much to comprehend. I just, want to get home and then I'll think about it afterwards. Community pharmacies run 2 services. One's a medicines use review, which they can go through all your tablets with you. If you bring your tablets into the pharmacy, they can go through each one and explain a bit about it, a bit like what I've done today. And then they also run a new medicine service. So if you get discharged from the hospital and you're not too sure about the medicines, you just wanted to get home, speak to your community pharmacy about this service. So again, they can look through your discharge letter and they can run through the tablets and why you're on them and answer any questions that you have. So those 2 services are really, really important and you should try and use them if you can, especially if you're not too sure about your medicines. Thank you very much.